Good morning, sir, and many congratulations to you on your milestone 100th birthday. Happy birthday to you, sir. I am Shashikant Nigam from Ahmedabad. You may recall me from MD Medicine 1983 batch, the first MD Medicine batch after your retirement. I am narrating three cases which influenced me during my clinical journey with you, sir. The first case was when I was PG student with you. A young boy in his early 20s presented with a history of limping from one leg only that occurred after a fall. He had an isolated foot drop. The case was discussed at great length with you, and our differential diagnosis ranged from traumatic peroneal nerve injury to Hansen's disease. So you did not agree with any one of our diagnoses. You insisted that we think again, but none of us were able to arrive to a correct conclusion because none of us examined the patient completely. Finally, it turned out to be a case of motor neuron disease presenting as a peroneal muscular atrophy. We were all focused on history of trauma and completely missed some clues. You emphasized the need for incorporating a complete examination when diagnosing any disorder. The second case, sir, you had joined Choitram Hospital and I happened to be the lucky registrar in medicine with you then. A lady aged 78 years was brought to our unit with peculiar complaint of short-lasting shock-like sensation in her left leg occurring intermittently 5 to 6 times a day for previous 3 days. I had no clue to the diagnosis with no examination findings. Partial epilepsy was considered, but there was no history of any post-ictal motor paralysis. I observed the episode once and I was about to label her as functional, but dare not to say so. In those days of pre-CT MRI scan, you advised carotid angiography and it turned out to be a case of right anterior cerebral artery occlusion. Fortunately, the patient improved with aspirin alone and went home. Case 3 was a sort of comedy of errors by me. Sir, I had diagnosed a case of spasmus nutans, which has a triad of nystagmus, torticollis, and head nodding in neurology OPD in a child of 3 years of age. On rounds after 2-3 days, while going from 4th floor to 5th floor, you mentioned that this is the first time I have seen such a case. Sir, you had a number of years of experience of teaching students over 30 years, and yet in my foolishness, I involuntarily repeated your line without thinking. Sir, you at first laughed, then immediately asked me, how long has been your life? I was left blank at that moment. It has been an unforgettable learning journey with you, permanently imprinted in my brain with you, sir, from September 1980 till today. Thank you much, sir. We wish that your blessings will always be there for us. Thank you, sir.